I've been exploring my depression through worksheets and activities. One of the exercises was to identify the causes of my depression and identify trigger points that can bring on or worsen depressive episodes. Seemed fairly routine to me, but it reminded me of a question somebody asked after seeing my first video. The question didn't come directly to me, so this is secondhand, but as I understood it, the question was, why is he depressed? I'm choosing to look at the question as, what is the cause of his depression, rather than what the fuck does he have to be depressed about? Not actually sure how it was intended, but that's how I'm going to answer it. I think by now everybody knows what depression is. The simplest definition, if I was going to define it, would be that it's a mood disorder characterized by persistent feelings of sadness and loss of interest in aspects of life. This isn't a case of the blues, and I'm not going to snap out of it. It requires treatment. Sounds simple enough. There are many types of symptoms that make up depression. Emotionally, I may feel sad or down or irritable or even pathetic. Physically, my body might really slow down. I'll feel tired. My sleep can be disrupted. It's really hard maybe to get myself motivated. Thinking can also change. It can be hard to concentrate. There can be memory lapses. Thoughts tend to be much more negative in general. People can be really hard on themselves, feel hopeless and just helpless about things. And even in some cases, people might have thoughts about not wanting to live. As a result, you just want to pull back and withdraw from people, from activities and all the day-to-day responsibilities. All of these symptoms work together to keep you trapped in a cycle of diagnosable depression. Now, everybody doesn't have all of these things happening all the time, or all of these symptoms. I don't. I have some of them. And sometimes one thing goes away and gets replaced by another. The point is, it's not the same for everybody. Depression can be as unique as the person going through it. It's also quite common. Between 8 and 10% of the adult population is suffering with depression on any given day. Upwards of another 6% of the adult population experienced clinically significant and diagnosable depressive episodes last year. Nearly 1 in 5 people is prescribed medication to improve their mood, like me. And the rates of depression are much higher in mental health professionals. One study found that 46% of mental health professionals suffered with depression. That's almost half the people surveyed. That is a staggeringly high number for any profession. So, what is the cause of depression? Well, there's no agreed upon single cause of depression. Most experts believe it's a combination of factors. We'll start with biology. People with depression appear to have physical changes to the structure of their brains. We still don't know what that means exactly, but some key differences have been identified. There's also brain chemistry. Neurotransmitters are naturally occurring chemicals that play a role in regulating our moods. When these neurotransmitters get out of whack, maybe not enough of one or maybe too much of another, you can get depression. Now, before any of my neuropsych friends lampoon me for that very simple statement, let me say that explaining neurobiology is not easy. Neurotransmitters are very complex, and it would take more time than I have today to explain it really well. Hormones also play a role. Changes in our body's balance of hormones can trigger depressive episodes. Think about how hormones affect you in puberty or pregnancy or menopause. Thyroid problems can also trigger hormonal imbalances that affect mood. Genetics also play a role. We do see depression running in families, and we have twin studies where we've looked at this over decades to see how genetics can play a role in this. And I'm going to throw out a potentially controversial cause. Willful behavior. No. Before anybody screams at the computer screen, let me explain. There is a threshold where we have the awareness and the resources to do things differently, to get medication, to start therapy, to join a self-help group, to make changes that reduce our risk factors. And if we don't do these things, we're then willfully contributing to the situation. Yes, it may have begun with some of those other causes, but there is a point where we choose to let it continue. I definitely can say that was a case for me. Besides the suspected causes, there are risk factors that increase likelihood of depression. Certain personality traits, such as low self-esteem, being too dependent, being self-critical or pessimistic in general. Exposure to traumatic events like physical or sexual abuse, or loss of a loved one, or a difficult or abusive relationship. toxic relationships, gaslighting, even financial stressors. And vicarious trauma is also a thing here. Being part of a vulnerable or marginalized group, such as being part of a community of color or the LGBTQIA+ community. Also, a risk factor is having a history of other mental health issues like anxiety, eating disorders, PTSD, or other more serious psychiatric concerns. Alcohol and drug abuse can be risk factors. And chronic medical conditions like cancer or heart disease or maybe recovering from a stroke. Some medications are also known to increase depression because of their interaction with neurotransmitters. So definitely something to always ask a doctor or a pharmacist about when you're filling a prescription. So what caused my depression? My best guess, as an educated professional, it's a combination of factors. Probably brain structure is a factor since I've struggled with this my whole life. For sure, there's a neurotransmitter issue. And I can say for sure because I'm responding to medication that targets that factor. And really, neurotransmitters are a factor in all mental illnesses. I don't think my hormones are out of whack, but maybe I'll ask the doctor to run a full blood panel just to make sure there isn't something else that we should be looking at. Genetics for sure, since this shit has run through my family for generations. Those personality traits like the low self-esteem, the pessimism, negativism, check. History of trauma, check, which I won't go into today, but I will say that my trauma exposure is both direct and vicarious, and some of it is quite significant and lasting. Vulnerable and marginalized, check. Other mental health issues, check for multiple eating disorders, check for anxiety. So a lot of contributory and risk factors for why I have depression. And of course, some willful component that I never want to acknowledge, but really was there. Some days it feels like I won the depression bingo game. So that's kind of an overview of depression in general, and specifically my depression, all of which I knew from clinical training and my own personal experience. But even with all that I knew, I lived mostly in a state of denial about needing treatment because I was functional. It's funny to me how people avoid treatments or interventions because they view themselves as functional, more functional than is probably realistic. Functionally depressed, functionally alcoholic, functionally anxious, functionally fill in the blank. For me, I defined being functional as being able to excel at my job, which, as it turns out, was also a source of vicarious trauma for me with all the forensic work I've done over the years and all the things that come into sessions, because I don't have a run-of-the-mill caseload. I have a caseload full of severe trauma and severe other concerns. So I used every ounce of my reserves to be good at my job. And at the end of the day, I had nothing left to give anybody else. I had nothing left to use for coping skills or healthy habits, which made it feel even worse because I felt like I was failing at life. That worsened my depression, which meant I had to dig deeper to tap into those reserves to be good at my job, which left even less of nothing for other areas. It just was not a sustainable cycle. How I did it for years is just completely beyond me. And now that I'm fully addressing it, life is getting a whole lot better. And that's my personal takeaway from these exercises and tying them to my specific situation. I absolutely needed to invest in myself, in my own health, my own mental health, if I was going to be able to continue with any sense of a meaningful life. And that was hard to admit. Like I said many times before, when you're the subject matter expert, it's hard to acknowledge that your subject matter is actually about you. But looking at how many therapists and psychiatrists and social workers and counselors have depression, I realize I'm not unique in that regard. What I need to do is set aside that level of pride and do what I advise others to do every day. And that's the takeaway for other people too. If this can happen to me, to somebody who does this for a living, I can engage in treatment, then there is absolutely no reason anybody else should suffer. That's what the depression means to me. I know it was a seemingly simple question that somebody asked, and it seems like it should be a seemingly simple answer. It'd be great if I could tie it to just this one thing that happened in my life, or this one issue that I'm dealing with, or this one medical concern, or any one thing that I could easily pinpoint. But the reality is that doesn't exist, especially not in my case. There are multiple issues over time that coalesced together to create this depressive spiral that I found myself in. And it didn't just impact me, it impacted the people around me. I'm really fortunate to say that the area where I dug the deepest, which is being able to get up and go to work every day and do my job, the area where functional, I think I actually really was functional. I say that because my business continued to grow day after day, month after month, year after year through word of mouth referrals. So the people I was working with clearly were getting some kind of benefit, or they wouldn't have continued and sent more people my way. But it took so much to make that happen. There really was nothing left. I would come home at the end of the day and be just so checked out. I wouldn't want to do anything. I wouldn't want to do laundry. I wouldn't want to cook dinner. I wouldn't want to clean up anything. I wouldn't want to go out with friends. I just wanted to just be there. That's not healthy. That wasn't a good way to be. Really wasn't a good way to try to share life with another human being. And recognizing that my depression, though it was my depression, really did have an impact on our relationship, and it was really hurtful to him. It hurt him to see me like that. He was hurting watching what I was going through, but my depression was also hurting him because I was withdrawn. I was aloof. I was indifferent. I was checked out. I was disengaged. I was sometimes just irritable or inhospitable or difficult to deal with. That's a lot. And it didn't have to get to that point. That's the hardest lesson that I'm learning about my depression right now is I could really have addressed this much sooner and probably had a very different outcome. Looking back and making the connections that I'm making, I can see this pattern over time. I can see where this depressive cycle that would go up and down and up and down, when it hit those really low points that I was at, where I have been earlier this year, I needed to have done something sooner. I'm glad I'm doing it now. Very glad that I'm doing it now, and very glad that I'm putting things in place now that I think are going to make it so I never get to that point again. And that's a good thing. And I'm hopeful that other people can do the same thing too. That's where I'm at today. I'll be back tomorrow.